The White House this evening is trying to establish widespread coronavirus contact tracing. That's an effort to track down the people to whom the virus may have spread to. And some officials say it's key to reopening the economy. But it's difficult and expensive. Sarah Sidner explains how it all works.
This was painful.
Amy Driscoll says coronavirus had her in a vice grip that wouldn't let go for weeks.
Every breath, every movement, every, raising your arms, rolling over in bed, every single thing is painful.
Less than 2 hours after arriving home from the hospital, her phone rang. It was the county health department asking lots of questions.
Who have I seen in the last 2 weeks? Where was I in the last 2 weeks? Who was I in contact with? Where do I work?
The health department was doing what is called contact tracing.
You have to trace every person who comes up positive. Trace means investigate. Investigate all those prior contacts.
Driscoll traced her steps. She'd gone to work. Her boss and staff had to be contacted. She went to a restaurant for lunch. She went to her hair salon. They had to be contacted. She went to a Cleveland Cavaliers game. All her family members who sat with her were contacted. This kind of contact tracing is happening across the country and the world.
Respiratory for the 8th floor.
From those suffering through the deadly COVID-19 outbreak in New York to those connected to the first major U.S. outbreak in Washington state, to California, the first place where a statewide stay-at-home order was announced. Experts say without contact tracing and enough testing, America and the world cannot reopen safely.
We're going to be at risk of resurgence of this disease, not just in the fall, but going into next year.
So you're saying without contact tracing, a massive amount, without testing, a massive amount, we could find ourselves right back where we started.
I think we could find ourselves very much at risk of another resurgence.
But the U.S. does not have enough people to do the tracing. State health officials estimate there are about 2,000 people doing this work now. But Johns Hopkins University warns we need at least 100,000. For now, contact tracing is only as good as your memory. This is hard. I mean, before stay-at-home orders, can you remember all the people you had close contact with over a 2-week period, say, at the coffee shop? Or at the grocery store? Or at a restaurant? Or at your child's school? And that's where big tech like Google and Apple are jumping in. They will soon have an app you can voluntarily download built with health departments so they can see detailed location data from your cell phone. But the public may be skittish about it due to privacy concerns. Still, contact tracing requires serious legwork. LA's mayor is pushing for federal help.
We're probably going to need hundreds of thousands of Americans to be put to work. It should be funded by the feds, but enacted locally.
As for Driscoll, her contacts have been found. The health department tells her that none have symptoms so far. But testing is still a problem.
I've had no additional testing.